Hey, glad to be here. I've done several echoes and presenting, and I've been able to attend over the year. So I love that this is still going. It's been a good opportunity for me in my profession. So we're going to talk about mental health and confidentiality. I know this is a broad group here today. Several of us are from a variety of different backgrounds and working with a variety of populations. We are going to focus primarily on campus mental health and confidentiality, and our cases will be primarily higher ed campus mental health related. But mental health and confidentiality is something that we can all join in on the discussion. But I just wanted to preface that we will be focusing primarily on campus mental health. And my name is Candace Layne. I'm the Behavioral Health Program Specialist at the West Virginia Higher Education Policy Commission, and I get to work with the behavioral health workforce as well as campus mental health. And my background is campus mental health. Minimize my box here. I do want to say that the information in this presentation is for information and ethics discussion purposes only. We are not legal professionals, and any specific questions of a legal nature need to be taken to the general counsel at your institution or your agency. I'll always, recommend to seek guidance from your licensed supervisor if you're still in supervision in the behavioral health workforce field. Your colleagues or your licensing board for any ethical concerns on campuses or at your agencies. So the best practice is ethical practice. And so ethics and doing what's best for the client always comes first. And so we know to follow the code of ethics for your discipline, if that's psychology, social work, or counseling or any other health profession, and your state licensing board. There's four main ethical principles when it comes to mental health and mental health services. Beneficence is to treat clients in an ethical manner and prioritize the well-being of the client. Non-maleficence, I always have to concentrate on that word, to do no harm to our clients. Autonomy, allowing our clients to make their own decisions and respecting this through non-judgmental and unbiased care. And justice. So we are to advocate for our clients and advocate for the behavioral health profession and advocate against social injustices. So these are the four main ethical principles that behavioral health care professionals need to make sure that are at the forefront of our work. So when it comes to confidentiality and ethics, we always want to make sure ethics is first, of course, and we always need to make sure that we keep information that is received from our client, any information received in sessions, information that's in their records, that we keep that private and confidential. But when we are talking about a college campus, this is a college community. And you don't know until you work in the higher ed campus mental health profession that this is a complete and total its own path of career, its own mental health um island, so to speak, and that it has a lot of different concerns that you may not see in community mental health or other mental health professions and pathways. And so when can confidentiality be ethically broken? We have to make sure that we are keeping the safety of the client at the foremost. If they are not safe or not doing well, we have to make sure that we get them to a place that they are. And we also have to make sure that we consider the safety of others. If clients make threats to other people, if clients are making threats to themselves, if clients are making threats to the public community, we have to think about the safety of others. And so it's important that we always make sure that we are going through all of these and determining, okay, what is best for the safety of the client and what is best for the safety of our community around us. So, of course, we know threats or violence allow for confidentiality to be broken only in the terms of that they are unsafe. We don't go into the past 5 years of our therapy about this client. We don't go into their background about their family unless it's some sort of violent act. But still, again, we have to make sure that we are protecting our clients' confidentiality, but just want to make sure that, before we talk about our cases, that we know that we have to make sure that we're considering the safety of others as well. If our clients aren't well or if they're making statements that may cause harm. Looking at higher education crisis and legal cases, I got this from an article, Privacy and Confidentiality, Balancing Student Rights and Campus Safety. And it says that concerns about balancing student privacy and confidentiality rights against the safety interests of the campus and larger community are included among the many related concerns about students who appear to be at risk for harming themselves or others. These issues may arise in diverse contexts, such as when a student submits a troubling essay to a teaching assistant or faculty member, when a participant in a study abroad program behaves erratically while traveling out of the country, when a student in a residence hall expresses concerns over a roommate's eating disorder, or when a conduct official suspects that a student's violation of the student conduct code may be related to a bigger and potentially more threatening problem. With my background in campus mental health, I have experienced some of these as a past director at universities that I've served at, and I'm sure many of you on this call have experienced some of these working in higher ed mental health, or even experienced some of these working in the community. And so, how and when do we go about breaking confidentiality, or do we break confidentiality? And these are the cases that sometimes we are confronted with and having to make these decisions. But how to balance student privacy when it comes to students' academics, students' privacy when it comes to mental health and healthcare rights. This is something that's, at the forefront of higher education, general council members, and something that's frequently discussed because we have to make sure we have that balance, but also protecting the rights of our students and our clients, as well as though the campus community. So working in the higher education field, we know that there is FERPA. FERPA is the Family Educational Rights and Privacy Act. And this is something that we have to adhere to working in the higher education field and working on college campuses. FERPA provides the protection of the student's education records and personally identifiable information that's not merely for directory purposes. Students also have the right to decide if they want to be included in a campus directory. And this even goes to a parent calling and saying, "Hey, I want to check on my student's grades," or how's Molly doing on campus?" We are not, able to say, "Hey, well, she's doing great," or even acknowledge that Molly's a student on campus. The parent is a proxy for students under age 18. Parents can also be proxies for students over the age of 18, but the student has to sign a consent allowing someone, their parent or someone else, to be privy to their educational information. There are limited exceptions, such as access for school employees with legitimate educational interests. But even to get access to these educational records, every staff member isn't privy to all the different parts of these databases, and those are very secure. FERPA is also incorporated in the Individuals with Disabilities in Education Act, covering students that may present with a disability. If you are a behavioral health worker or, any staff or faculty member on campus also has to deal with HIPAA, and we're confronted with HIPAA when we have campus counseling centers, when students may provide past medical records to receive campus accommodations if they want to sign up with the accessibility office. Sometimes some campuses have help programs and different programs that are available for students that may have disabilities, and so they may have to provide their records for that. And there's other wellness centers, health centers on campuses that may have HIPAA protected records. So the Health Insurance Portability and Accountability Act, it provides national standards that protect the individual's medical records, which is called the protected health information. It includes health providers, health plans, health plan and healthcare clearinghouses, all healthcare providers. It provides safeguards to protect the privacy of protected health information, limits and conditions for the use and disclosure of protected health information. It provides individuals with rights over their own protected health information, and individuals have the right to examine as well as to request corrections to their health record. But we know parents, there's parents when we think of higher education. When we think of students that are traditionally aged college students, primarily that 18 to 24 age range, not always, but oftentimes parents are providing financial support for their children. Many times parents are the ones paying for this education. So oftentimes we're going to get calls with parents saying, well, I'm paying for their education and you won't tell me anything, or I have the right to know what's going on with my child. And we have to say, well, your child is 18. We do not give any information out to anyone that calls unless there is on record. And so it's difficult, to manage that and accommodate parents when, they want information about their child. I'm a parent, I get it. But there's laws and there's ethical principles that higher ed professionals and behavioral health professionals have to abide by. Sometimes just calling and saying, is my child safe and okay? Now, there are hopefully procedures on campuses that centers and other departments would check on these students when you get these calls. But it's difficult when students haven't signed consents or FERPA agreements to allow other people to be active in their treatment. And so it does create some difficulties for staff members. So regardless if parents are calling, regardless if parents, have a right to know, if they feel they have a right to know, we still have a legal and ethical obligation to protect the student and client's confidentiality. So, it's important to encourage open communication between the parent and the child. Contact the student, say, hey, this is what's going on. Your parent's been calling. We encourage you to contact them. Sometimes when a student, maybe you're worried about them and you've built rapport with this student, encourage the student to call an emergency contact or a parent, right then, right there. And you can document that. And so, they can disclose their own information if they're willing to do that. But there are some times when we do have to break confidentiality and may have to call emergency contacts. We have to remember that campus is a community. Like I said, this is, it's different than some other aspects of mental health. Now, it doesn't make the ethics any different, but some of the experiences and cases that you may come across may bring up some different challenges. It's important that open communication is very, very important, making sure that, faculty and staff, it's communicating with one another, making sure that we're protecting the safety of all students, faculty, and staff. That's the utmost importance. Making sure that we have campus resources and support, not just for our students, but also for our staff members as well. And providing resources to students of concern. We don't want to have to break confidentiality or say, this student has been concerning or verbalizing threats to themselves or others. And so making sure that we're providing quick prompt services to students of concern and making sure that, as faculty or staff, that we make sure that we're connecting with our campus counseling centers and health professionals or campus police if need be, if safety is a concern. Since the unfortunate Virginia Tech shooting, after that, BIT teams became a big thing. There is the National Association for Behavioral Intervention and Threat Assessment called NABITA, and this group was established after the Virginia Tech shooting. And afterwards, what was found is that prior to the shooting, several faculty members and staff members, they had concerns about the student that did the shooting, and there was some concerns and questions, and I think he was even brought in for sessions, but afterwards it was found that there were a lot more concerns and a lot more severe things that happened, but the communication wasn't there. And so we've learned from that, and behavior intervention teams have been developed to focus on campus safety, the health of students, and the academic success of the student. And the purpose of the BIT team is to identify students that may show signs of trouble, that they're being disruptive, maybe having behavior concerns on campus or violent behavior. But not just to identify them and they're in trouble, but identify them and provide support and resources. and help them be able to be successful on campus. Membership often includes faculty or staff that represent campus mental health, campus health, security or police, student support services, residence life, or discipline and student conduct. The teams meet regularly to discuss any students of concerns or anything going on campus that may be a safety concern. There's a need to have a system in place to communicate with mental health and other staff while also protecting confidentiality. There's ways about doing that. We don't have to disclose everything about the student, but just knowing the student is connected with services, and if anything more happens, we will let you know, but it's important to know that, if there are concerns, and there's several concerns being brought up about a student from faculty, from other departments, that we're discussing that, we're making sure the student has services. We want to include and provide informed consent and open communication about confidentiality and procedures that we have in place for this. It's a campus responsibility. It's important to have a structured system for interdepartmental communication. Some systems use Starfish or Advocate, or there's other different systems that campuses can put into place where faculty, advisors, and other staff, mental health and healthcare staff on campuses can communicate with one another. They can put flags on students if they have different concerns about students. And so it speeds that communication up, and it's able to put everyone on one page. It's important to have an electronic documentation system to make sure things are in real time and people can see up-to-date records and information or flags if need be. Making sure we're having training for faculty and staff and students. If you see or hear something, say something. Sometimes people may not want to speak up or think, well, maybe it's not a big deal, or maybe this is going to be, breaking the student's confidentiality. But it's important that if we see or hear something, we say something, and we allow the mental health or healthcare professionals to deal with that on campus. And making sure that we have teamwork and support as well for students and safety on campus. It's important when we talk about confidentiality that, the counseling center also has a responsibility as well, that, if there are threats of violence or threats against self or others, that we're doing what we can, making sure we have up-to-date emergency contacts for students utilizing services, making sure that we include information and then informed consent that says, if you're a threat or harm to yourself or others, we will break or have to disclose your confidentiality, making sure that we say, if you are a harm to yourself, we encourage you to contact an emergency contact. If we feel we need to take you to the hospital, or you're unwell, we may need to disclose that information to an emergency contact. A short case, working in my past, we helped a student get to the hospital. They were mentally unwell and unsafe, and the student did not want to alert their parents, and they were over 18, and encourage them to call and let their parents know. Well, the parents thought of missing persons on this student. And so it brought up the discussion about, whoa, where does that information lie? Where does that breaking confidentiality lie at in there, And then we were able to let the parents know what was going on. The student was safe and okay. We knew where they were and allowed the student to give them more information. But that's just an example of how confidentiality, student health, and mental health on campus can all come into play. Making sure there's representation or communication with the behavioral intervention team, not for you to go and disclose information so that you know what's going on with safety, and you can be included into that and be able to speak on anything if there is a major concern about a student, that you're able to say, the student is not in services and we need to get them connected. Making sure, again, updated emergency contacts, having clear forms and clear procedures, and clear information in informed consents. Myself and Carolyn Kennedy, again, we are in the Behavioral Health Division of the Higher Education Policy Commission. And any questions, if you have, please, contact us. And again, we are not legal professionals, but just want to bring up some important topics and cases that can come up when it comes to campus mental health and confidentiality.